Urgent care facilities have revolutionized the way we get medical treatment. But a startling study suggests that nearly half of antibiotics prescribed at urgent cares are unnecessary. The statistics, however, don't tell the whole story, so our investigative producer, Leslie Marcus, hit the street to uncover the overprescribing practices that could put your health at risk.
These days, urgent cares are the fast food of medicine, and it seems like there's one popping up on every street corner. In fact, you're probably one of the 160 million people that visit an urgent care every year. But studies suggest these places are passing out antibiotics like candy, and I want to see how pervasive this practice really is. I made a map of urgent cares throughout the city that I plan to visit, and I'm going to tell them that I have the same symptoms. I'm feeling pretty lousy, I have a terrible headache, and some congestion. But the truth is, I'm not sick at all. I just left the first urgent care behind me, and I thought it was strange that at the front desk they offered me Botox and other cosmetic treatments that I could have an appointment for directly after my urgent care visit. I saw a physician's assistant for just a few minutes who ran some basic tests, and I left there with the prescription for antibiotics, and I was also offered vitamin injections to boost my immunity. And I got this brochure as well for some Botox. This urgent care I just visited was advertising laser hair removal and fat loss treatments inside. I met with a physician's assistant for just a few minutes and left with more antibiotics. I'm off to the next urgent care to see how quickly these places are to prescribe me more antibiotics. I just left the third urgent care where they were advertising weight loss surgery at this clinic. The doctor was actually the surgeon that prescribed me this Z-pack of antibiotics, and he wrote me a prescription for a nasal spray and antacids for my stomach for what he said was a sinus or upper respiratory tract infection. I have more urgent cares to visit, but right now my findings are pretty alarming.
Leslie joins us. This is not unexpected. What you experienced, I could have predicted this, but were you shocked? And you had other urgent care visits after this. What happened at those?
I was definitely shocked at how easily I was prescribed all of these antibiotics. I visited 5 different urgent cares, and I got antibiotics at every single one of them after basically a 2-minute meeting with
And you weren't sick, really?
No, I wasn't sick at all. This entire investigation started from a bad experience I had at an urgent care when I was really sick. So I went to a popular urgent care that a lot of my colleagues go to, and I saw the doctor for a couple minutes. I was feeling really lousy, I had a terrible headache, and he immediately jumped to the antibiotics. He gave me a shot of antibiotics, he gave me a steroid injection, I got a prescription for antibiotics, and then I also left with a prescription for tramadol pain medication, which the doctor told me it's safer, it's less addictive than the popular pain medication on the market, but the BMJ new study says that actually is untrue. And so I started doing more investigating, and I found out that 10 other people that I work with went to that same urgent care and had the same sinus infection diagnosis.
Do you want to know why so many urgent cares exist? They're incredibly profitable. And it's also, quite frankly, one of the reasons why you're getting shots instead of prescriptions, because shots are profitable. And look, plenty of overprescribing also occurs in emergency departments and clinics across the country, but I've seen urgent cares pop up at every single street corner. It's literally, there's like more urgent cares than gas stations. It's almost like the minute someone gets a sniffle in this country, we feel like we need to go get treatment. And the great majority of the time when you go, you have a viral infection anyway, but you're gonna end up with antibiotics. And that's what just, it drives me crazy, because we live in a time where thousands and thousands of people are dying every year from antibiotic-resistant organisms. Every time you take an antibiotic, we're not talking about the risk side effects, the C. diff colitis, potential death, how it ruins your microbiome. And the fact that you, every single one you went to, without even really talking to you, it was like preordained that you were gonna get this antibiotic. It's crazy.
Preordained, given the diagnosis of sinusitis, which bacterial sinusitis, which you cannot make without a positive X-ray and or a culture.
And Drew, let me ask you this. In fact, let me do this. Let me bring our infectious disease expert, Dr. Ravina Kular, back into this. Sinusitis, let's just say it is sinusitis. What is first-line treatment?
First-line treatment is just water taking care, not having antibiotics.
Maybe some nasal
Maybe
saline
some
washes.
nasal, exactly.
So, and
not
there's
an
still this
antibiotic.
theory out there that someone says, oh, sinusitis, like, must throw antibiotics at it. And that's prehistoric medicine. And it drives me crazy.
This urgent care business, it's so competitive. It's an $80 billion industry. And a lot of it has to do with the 5-star reviews. The urgent cares that had the 5-star reviews were the ones that were passing out antibiotics. And the ones that had 1-star reviews, people were complaining that the doctors weren't doing anything. And I just want to say that when I originally went to that urgent care and I took the antibiotics and I had the shot, my mouth was so inflamed. And I went to a dentist appointment, and the dentist actually took one look at my mouth and said, how many antibiotics are you on? She's like, basically, your body attacked itself because you were on so many antibiotics plus that steroid injection, and it was extremely painful, and that really motivated me to do this investigation.
We were just talking about it disrupting the microbiome that we naturally have in our mouth, and that was a direct result of being on too many antibiotics when you didn't need them.
Definitely can have some side effects. And I've been in the burn unit because somebody had a bad reaction to an antibiotic. And I'm a GYN, so you know why they called me. Their genital area had been impacted. So you really want to think about the risk and benefits of these medications.
And let's talk, Dr. Clark, I want to talk to you because earlier in the show we talked about vaccines, which have just for some reason have a terrible reputation among so many people. And then here we have antibiotics. Everyone thinks they're as good as candy. No one ever talks about the side effects. It's literally like they've gotten a free pass. And obviously, they can't be given without a prescription. And quite honestly, a lot of prescription-happy practitioners of medicine, I'm not trying to be critical, but it's just true. How did this happen? Because you're an infectious disease expert. You have to deal with both sides of this coin. Can you talk a little bit about that? Like, why antibiotics seem to get a free pass in society? Like, take as much as you want.
Unfortunately, I don't think society knows about the implications of the negative implications of antibiotics. The World Health Organization has stated it's the biggest public threat to society. I can tell you, me, myself, I've treated patients that we have no antibiotics available to treat those patients with because they've developed resistance to every single antibiotic. So over 700,000 people currently have died due to antibiotic-resistant infections.
Coming up.
Do I need this antibiotic? Because if I don't need it, then I don't want it. They're just giving it out blindly.
Then, scientists are looking into extracting vaginal fluid from a healthy donor and transplanting it into someone with BV. That's coming up.
These days, urgent cares are the fast food of medicine, and it seems like there's one popping up on every street corner. Studies suggest these places are passing out antibiotics like candy, and I want to see how pervasive this practice really is. I just left First Urgent Care. I saw a physician's assistant for just a few minutes who ran some basic tests, and I left there with a prescription for antibiotics.
We're back with our urgent care investigation. Certainly a use for urgent cares.
Yes.
No question about
Absolutely.
it. I would urge everyone watching right now to not assume that the doctor who tells you you don't need antibiotics is a bad doctor. I would argue that most likely that is a good doctor trying to take their time to explain why you don't need them and why, in fact, taking them would be bad for your health and potentially others as well. But if you need an antibiotic, and you need it, and you're talking to your doctor and they're a good doctor and they say, you need this, you have pneumonia, you need to take that antibiotic. So it's life-saving on the one hand and killing people on the other. So what do you think's the answer?
I think education is power, and education not only for the patients, but also the clinicians. Urgent care providers, they aren't infectious disease trained. And when we all became in the healthcare profession, we all signed an oath that we would protect all of society, and giving antibiotics away is not a way to do that, but education is a way to do that. So what I have in my setting, my practice setting, is I have a commitment poster that I've signed that I will only give an antibiotic if you really need that antibiotic. And it gives pamphlet, there's also a brochure and pamphlet for the patient to read in that waiting room so that they're educated in that free time. So short answer, education. Education to the patient, education for the provider, for them to really want to learn about the negative consequences of giving an antibiotic.
I think that when you go to an urgent care and you're not feeling well, you shouldn't go in there trying to get antibiotics in the first place. And it goes back to your point, Travis, where it's like, you should ask the doctor, do I need this antibiotic? Because if I don't need it, then I don't want it. Like, they're just giving it out blindly, and you may not need it. That's not gonna do anything good for yourself.
Well, and the cultural norm is, and I've seen it look in this office, we've had a lot of producers over the years that have learned the hard way, but it's, they get the sore throat, a little bit of stuffy congestion, and it's, I have a busy week at work. I need to nip this in the bud and go get an antibiotic. So you've already created this paradigm in your mind that you need an antibiotic to get better. When the reality is it can take 7 to 10 days for a cold to resolve. And if on day 3, you go get an antibiotic, you're gonna get better in 4 or 5 days regardless, or 2 or 3 days later, and you mentally associate it. I mean, we used to have producers line up going to these urgent cares. Is that fair to say?
Yeah, absolutely.
And remember what I would say? You guys, you have a cold. You have a cold, it's a virus. But what is everyone doing now? It took time, but the conversation has shifted, hasn't it?
It has shifted, and I'm glad it shifted. Yeah.
And so now the idea is
like
that
you
it should
said,
shift throughout the country.
Well,
Everyone here.
unfortunately, you know, Travis, my kids, as you know, are both physicians and went to medical school recently. And I know for a fact that medical school now is driving it into their students that you prescribe antibiotics only when you've made a diagnosis, you've identified a specific organism that's sensitive to this antibiotic. That's the only indication. I'm not sure why these doctors are changing their thinking once they get out into private practice.
Sometimes it's because, like Leslie said, what she found, people...
The patients aren't going to be happy. They're not going to get the rating.
Right, and they want a good
Which is really
review on the internet.
So it's incumbent upon all of us as healthcare providers, as patients, and I don't think anyone here is trying to undermine the importance of antibiotics or having easy access to care, but just be aware when it comes to your own family and ask, is this antibiotic necessary? We did invite the Urgent Care Association trade group to join today's discussion, but they declined and sent us a long statement instead that includes the following. The Urgent Care Association and our members are committed to being part of the solution to ensure appropriate antibiotic prescribing. They then describe at length how they are taking part in an antibiotic stewardship initiative. They conclude by saying, we will continue to focus on responsible antibiotic stewardship and appreciate the commitment our members have made to responsible antibiotic prescribing. And in defense to that statement, it's incumbent upon the individual practitioner at every urgent care, at every clinic, at every emergency department. It's incumbent upon them. I mean, it's the individual prescriber who needs to make better decisions. The entire statement, we're going to have that on our website, thedoctorstv.com. Dr. Sklar, thank you so much for being a part of today's show. Still more to come. Coming up, scientists are looking into extracting vaginal fluid from a healthy donor and transplanting it into someone with BV. Then, the only show on TV where everyone at home has a chance to enter to win the Word of the Day giveaway. Find out what it is. That's coming up